Good evening again. My name is Jamarah Amani, and I am the director of Southern Birth Justice Network. I'm also a licensed midwife and a mother of 4. I had 2 hospital births and 2 home births, and I'm excited to share this information with you all about maternal health, about birth justice, about advocacy, about knowing your rights. We know that Black babies are dying at higher rates, are born prematurely more often. We know that this relates to power disparities, right? So power disparities relate to health disparities. Health disparities don't happen in a vacuum. They don't happen because someone is Black. They don't happen because someone is not taking care of themselves. We know that when we have a group of people that, because of their identity, their racial identity, are being marginalized in the healthcare system, that the issues are deeper than just talking about pre-existing conditions, right, or risk factors. I mean, we are seeing the same thing with coronavirus, that there's a lot of blaming and shaming of the people who are most marginalized, and instead of looking at the that are responsible for the spread of the virus and the conditions under which people receive care. So we know that increasing the power of marginalized people helps to improve health outcomes. And that's why we are doing this training, because we want to give folks information to be able to access the knowledge that leads to the power, that puts you in a position to advocate for yourself or for others, and to be a part in your healthcare decision making, and to have a say in what happens in your care and in the care of those that you love. So we understand that disparity relates to the social determinants of health. And disparity really just means that there's a difference in outcomes. And that difference is based on things usually that are socially determined. So we know that race is one of those things, and also there are other things like income, education, access to healthy foods, transportation, disability. All of those things can impact people's health. And so, as I mentioned earlier, that Black birthing people are 4 times as likely to die from causes related to pregnancy and birth. And some of the stress factors relate to racism, lack of access to care, lack of follow-up, and culturally and racially inappropriate care. And we're going to talk a little bit later about self-care. So when we talk about pre-existing conditions and risk factors, we always need to talk about self-care and community care, and how people can create spaces to take care of themselves and alleviate some of that stress that comes along with being a racialized or marginalized person within our society. So this is the Birth Justice Bill of Rights, which is a tool to know your rights and advocate for respectful care, because you deserve respectful care. We know that health disparities are a reflection of power disparities, and that those have to shift in order for us to be healthy. So these Bill of Rights are not exhaustive, right? There are more rights than this, but it is just a representation of things that are important to many birthing people, and that you can use to advocate for yourself and others. We know that the historical exploitation and abuse of Black folks in the medical industrial complex has implications for health outcomes. So this Bill of Rights is centered on Black mamas and non-binary transgender parents, and on the realities of our lives. So as a Black preconception, pregnant or birthing or postpartum person, these are some of the rights that that you have. So preconception, meaning before pregnancy, so even trying to access healthcare and trying to get pregnant. I live in Florida. I practice midwifery in Florida, and this is a state that does not have Medicaid expansion. So that means that a lot of people don't have access to basic healthcare if they're not pregnant. And that is an issue because many people, Delmar and I were just discussing this right before we got on, that many people come into prenatal care with conditions that, or health issues that have not been addressed for years. You know, things like not having had a pap smear for in the last 5 to 10 years, or not having had a basic physical, or not being able to get their medication or access to mental health care. And so preconception is really important, and intraconception, meaning between pregnancies, is also really important because that's a time when people are really vulnerable. And we know what pregnant means, we know what birthing means, and postpartum is the time after giving birth. And that can be immediate postpartum, like within minutes or hours after you gave birth. But that postpartum really, according to many leading health organizations, should be covered for a year. And there's legislation around the country right now to extend, including in Florida, to extend postpartum health insurance, so Medicaid health insurance, for the year after giving birth, because we know that that is an important time, that entire year. Currently, most folks are only covered for like 6 weeks, maybe 8 weeks after they give birth. So let's go through some of the rights. The first one is the right to stand against racism. Excuse me. So culturally sensitive and systemically aware healthcare and health providers is really important. All healthcare providers should be trained on cultural humility, cultural awareness, but even beyond that, it's important that we have enough providers that are Black, that are Indigenous, that are representative of the communities that they are serving. And because many folks feel more comfortable with a provider that is what we call culturally congruent, someone who matches them, someone who they don't have to explain, you know, what their name means or how they do their hair or their family structure or what they're eating, because that provider would already have a level of understanding, being from the same community and the same culture. So one of the things that National Black Midwives Alliance is doing is trying to increase the numbers of Black midwives. And so number 2 is to have my healthcare providers recognize that the history of Black people involves medical abuse, exploitation, and discrimination, and that this generational trauma affects our ability to trust the healthcare system. And so the healthcare system is operating at a deficit when it comes to Black folks, right? Because of those histories that I just named, the onus is on healthcare systems to build that trust. We should not expect that people are going to come into healthcare 100% trusting their doctors or even their midwives or their doulas, right? That trust has to be built. And that's because people almost expect to be exploited or discriminated against. And so that's work that healthcare institutions and practices need to do. And even as a doula, I mean, giving serious thought and attention to how do I build trust with my client is a really important point. Number 3 is honoring values. So it's important for folks to understand what their values are. What are the things that are important to you in your healthcare? It could vary. It could be that someone speaks your language. It could be, like I mentioned earlier, cultural congruence. It could be that someone, respects your religious beliefs. But it's important that providers honor the values of those that they are serving. So holistic, compassionate care that incorporates the healthcare values of the person receiving care. So number 4 is expressing culture. which means respect for personal beliefs, cultural traditions, and ancestry. Number 5 is developing a network of safety and support. So developing a support system that feels safe and empowering. So it's important to, check in and ask who supports you in your life. And if someone doesn't have that, to point them in the direction of the resources so that they can build that. And being part of that network as a provider, as a person that is providing care, being a part of that network. And if you are a person that doesn't have a network of safety and support, reaching out and saying, like, I really need a support system. What are the resources? And there's many community-based organizations. There's many online communities where, and that's, to me, one of the benefits of us all being home and socially distanced is that there's a lot of online communities developing. And I see this particularly around mental health, that there's a lot of support groups happening online and things like that. So being able to, access that network is really important and vital, because many people that are accessing healthcare feel alone. Many pregnant, birthing people feel like they don't have rights. I had a mom call me about 3 days ago now and tell me that she stayed with a provider that was disrespecting her, actually called her names, and made fun of her because she felt like she didn't have another option. And oftentimes when people are not connected to a support system or support network, they don't know what their options are. So that's really important. Number 6 is to represent my Blackness. So to have my racial identity recognized and respected in all care settings. Again, that goes back to representation. That goes back to cultural congruence. But it's also about feeling welcome in a space. So you have the right to walk into a space and feel that you are represented there, that you are welcome there, to see images of yourself, to see people who look like you, to have the language, accessible to you, and to be able to talk, dress, express how you want, and how you feel safe doing. Number 7 is care for all of my identities. So that means respect and consideration for intersecting identities. So intersectionality is a big value that I hold, and that's a part of birth justice and a part of just making sure that folks are represented and uplifted and heard. And some of those intersections are around race, gender, sexuality, disability status, socioeconomics, immigrant status. So it just really means making sure that we're not treating people in one way because we make assumptions about who they are. And that if that's something that is being done to you, that you have the right to have all of your identities represented. So going into a provider's office and them assuming that your partner is male, or that you're married, or that you want more children or don't want more children. I've had many clients share with me being offered tubal ligations and hysterectomies literally minutes after they delivered, receiving a depot shot literally minutes after they've delivered, because the providers made assumptions about what they wanted for their lives. And so being in a position to advocate for people really means that you have the right to be recognized for exactly who you are, whether that is your pronouns, whether that is your relationship status, and that there should not be any shaming of that or any assumptions being made around that. Number 8 is protection from violence. And this means having your life preserved and your wellness uplifted. And that includes in your family, your community, by the state, by your healthcare providers. So we know that many people are living in communities that are violent, where they are fearful for their lives of just walking down the street or going for a jog, or just sitting on their front porch. And that's a violation of a basic human right to be safe from violence. Also, going into a hospital to give birth. Obstetric violence is a real thing. Obstetric violence really just means a violation of bodily autonomy during pregnancy, birth, or postpartum. And that's when someone does something to you that you have not authorized, which could be something like removing your placenta without, your permission, suturing you without pain medication, using forceps to deliver your baby. All of these things happen in hospitals all of the time, every single day. And this Bill of Rights is just really stating that that it's not okay, and that you have the right to advocate for yourself. And one use of this Bill of Rights is to literally bring it into an appointment with a provider, and make it a part of your birth plan, and state what each of these rights mean to you, or select the ones that are, there's 22 rights here, so selecting the ones that are most important to you. Like if you're really concerned about being violated, or you're supporting someone that's really concerned about being violated in the hospital, then that needs to be written into the birth plan. No one is to touch me without my permission. And that should just be point blank. Number 9 is understand how racism impacts my health, and understand my health. So having a thorough review of health history, including pre-existing conditions and risk factors, and to be involved in developing a care plan. So I showed earlier the picture of Serena Williams, and one of the things that she stated when she was being discharged from the hospital and trying to stay because she knew that something was wrong, was that the people who were providing care for her, the nurses and the doctors, were not familiar with her health history. And so therefore did not understand that she was at risk, and why she was at risk, and why she was so adamant that, no, you cannot send me home. I need to have this medication so that I do not die. And that was something that she really had to basically ask for a second opinion, ask for different providers, raise hell to just be able to be heard about her own health history. So I think that if people have relevant health issues that might impact their outcomes when giving birth, then it's important to include those in the birth plan as well. And that can be, I've seen forms where people put it on a separate sheet, these are my health issues. So that if it's shift change and the new shift of nurses hasn't read the chart, or your regular doctor is out of town or not available, that whoever is providing the care is really familiar with what your health issues are and what support you might need around that, and what the care plan looks like. Number 10 is respect my family structure. So that includes familial and intimate relationships, including non-heteronormative partners and extended family. So we know that, Black folks, people of color, our families don't necessarily look like what is considered the nuclear family, or what is considered the norm, although we know that normal is, a social construct. So including the right to have your entire family included. Now, obviously during a COVID-19 pandemic, there's limitations around who can go in with you. But the recognition that families look different, the recognition that, okay, I may not be partnered. I might be a single person who decided that I wanted to have a baby on my own, and I shouldn't be shamed for that. I shouldn't be judged for that. I might be a young parent that, you know, has a family support network that is important to me to include in my healthcare. I might be a person who has multiple partners, and that doesn't make me weird or, you know, it doesn't give providers the right to deny me access or, you know, the right to have people that I love and care about involved. So respecting the family structure. And that means that birth certificates might need to look different. That means that parenting agreements might need to be included in the birth plan or the care plan. And just really making sure that even like our intake forms are inclusive, asking people what their family structures look like instead of prescribing it to them by having a line that says father of baby, right? So those kinds of things have to shift within the current healthcare system in order for people to really feel included. Because we know that even if we put out, you know, some kind of statement that says we're inclusive, if we haven't really done the work of training staff, of training, you know, the personal work of getting over our own biases, and the systemic work of making sure that access is available to all different types of folks, then we haven't gone far enough. Okay, so number 11 is comprehensive care after I give birth. So this means preventive postpartum health services, because one study showed that 50% of maternal deaths were actually arose during the postpartum, and some of those related to domestic violence, some of them related to mental health issues and substance abuse issues, as well as postpartum hemorrhages that happen later at home. So the way that most birthing people are discharged from the hospital, there's not a lot of follow-up that happens after they go home. If they don't have a doula checking on them, or they don't have aftercare nurse checking on them, if they're not going back to their OB's office for 6 weeks, which is the norm, a lot of things can happen in that time, and we're losing people in that window. So part of the rights is really to demand, as I mentioned earlier, that Medicaid and health insurance in general cover postpartum care for a year, and that the range of services really be expanded to include mental health services, to be more comprehensive, to include home visitation and follow-up care. I believe it's in Cuba where they go and check on people after they give birth every day for I don't know how many months.
For the first 3 months. For the first 3 months.
And so, I mean, what would that look like in our healthcare system, and how would that change the outcomes? Well, we know that it would improve things if we had that type of support built in. And so since we don't have that, that's why postpartum doulas are really important. That's why that network of support that I mentioned earlier is really important, to really hold and support people who are postpartum, knowing that there's so much lacking in our current system. Okay, I'm gonna try to keep moving through these because we still have a ways to go. Number 12 is support from my doula. I mean, all of you who are here are either looking to be doulas or are doulas, or have been in that support role for someone or want to be. So that just means that people have the right to access support from a birth companion for advocacy, accountability, and comfort, and that's part of the rights. And right now during the pandemic, of course, the access to doulas is being limited. And that is on one account necessary because of social distancing, and on another account, when you take something out that people are getting support in a way that people are getting support, then we have to figure out how to replace that. So whether that is that we train all labor and delivery nurses to be doulas because they're already on the staff of hospitals and already have to be there, or we find some way to really make sure that everyone has virtual support. I mean, there are ways and strategies that could be employed, and everyone deserves that support. Number 13 is access to everything I need to be healthy, including healthy foods, vitamins, clean water, and transportation to get to those things. Number 14 is support in reducing stress. We talked earlier about the stress of racism and other social determinants of health. So people deserve to have support in reducing stress, and that includes self and community care, includes detoxing white supremacy and microaggressions and patriarchy, and all the things that stress birthing people, that stress women, that put stress on marginalized people and make it more difficult to have a healthy pregnancy and birth. Number 15 is inclusion in the decisions that affect me. This is really probably one of my favorite ones, and I think really the foundation that holds up everything else. Because if we are asking people what is important to you and including them in what healthcare looks like from beginning to end, then all these things are already there. So it really means shared decision-making in all healthcare options, including comprehensive sex education, preconception and intraconception care, access to pregnancy termination. We know that non-consensual pregnancy is a thing. It's very common. About 40% of people who are pregnant didn't necessarily plan their pregnancies or want to be pregnant. And access to termination is important in terms of upholding people's rights. And then access to prenatal care, birth, and postpartum care. And that people are partners in their decision making. So if the care plan changes, which means if you go to your 40-week prenatal appointment and the doctor is saying, okay, I want you to head over to labor and delivery because we're going to induce you now. That should not be a prescription that is just told to you. And it gets told to pregnant people every single day. It's so rampant, and it's becoming even more so during the pandemic, because anecdotally I can share that many doctors are not wanting to have a lot of pregnant people on their rolls right now. They want to have less clients. They don't want to be waiting around in hospitals for people. And so more folks are being induced and given C-sections because doctors don't want to be spending time in hospitals. And they have the perception that it's a better solution to just get the baby out versus waiting for folks to go into labor naturally. And that was already a big problem before COVID-19, but it's even being more exacerbated by the pandemic. And so if people are not being included in those decisions and they're being told what is going to happen to their bodies, then that is a complete violation of their rights, which takes us right back to the piece about obstetric violence. What are we on? 16 is the access to all birth care options. So that means that that midwifery needs to be legal everywhere, which it's not. It means that doulas need to be accessible everywhere, that there needs to be a birth center in every neighborhood that is independent of hospitals and allows people access to natural care options. And that brings us to number 17, which is honoring the natural birth process. And that which means to be able to manage my labor according to the evidence base of physiologic birth. including the birth environment, non-invasive interventions, movement and positioning, eating, drinking, and compassionate care. And these seem like really basic, especially to those of us here who may have given birth in out-of-hospital settings and birthed on our own terms. Just like, yeah, that's basic. You should be able to eat and drink in labor and move around. But it is a fight in hospitals to even do the basic things. And sometimes a fight. I had a client that delivered 2 weeks ago who was threatened with them calling the police on her because she wasn't doing what they wanted her to do. And so that, again, brings us back to safety and violence, and that the way that people's rights are denied in care settings is through enforcement of the state. And so we have to remember that when we're talking about rights, we're really talking often about legal battles, and we're often talking about the battle of freedom. Because in a hospital setting, if you don't do what they are telling you to do, they can call security. They can call the police. They can get an order to have your children taken away. They can call the Department of Children and Families. And so, some of these might seem like, okay, well, is that really that important? And I think that a lot of people are telling themselves a story that it's not that important because of fear. Because I don't want to go up against a system. I don't want to go up against a doctor that could potentially decide whether or not I can keep my baby, could decide whether or not I walk out of here a whole person or walk out of here with a uterus. And that's really just honestly too much power for the system to have when it affects the lives of so many people. So the next one is supporting my baby's right to human milk. And that includes access to lactation support, starting from prenatal lactation education, going all the way to immediate skin-to-skin contact with the baby, and lactation consultants within the first few hours after birth. And so one of the things that I really value as a midwife is that what we call the golden hour, which is that hour after birth, which is ultimate bonding between the parent that just gave birth and the baby. And what's really sweet about that is that nature has set it up beautifully, okay? So when the baby is born, if you don't tug on the placenta and deliver it right away, if you don't cut the cord, the baby really cannot go anywhere, because one end of the cord is attached to the placenta and the other end of the cord is attached to the baby, and the baby goes right to the mother or parent's chest. And that is how it is literally designed to be. And when we start messing with it, when we start cutting cords early, when we start yanking on placentas just so we can, deliver the baby and the placenta quickly and close up the uterus quickly, then that goes against the physiologic process of breastfeeding, because all of that is part of how the human body works to produce the milk, is that skin to skin and all of that, being as natural as possible. Now, that doesn't mean that we never intervene. There are times to intervene. There are times to do something different. But the intervention being the standard and what's happening to most people means that most people are having their baby's right to human milk interfered with from the moment of birth. Number 19 is the right to get a second opinion. And that is something that I also see people are really scared to do, because they don't want to lose their healthcare provider and end up without a birthing option. And so sometimes they just go along with things. But you always have the right to get a second opinion. Even if ultimately, you do have to have the induction or the C-section, or it is best for your baby, it is good to know that from more than one provider. It is good to know that from more than one source. If a doctor says, or an ultrasound says, oh, your baby is too big, go to another facility and get another one. If they say, oh, your fluids are too low and you need a C-section, ask what all the options are. And can we test again tomorrow? You know, it's always good to ask for more time, and Delmar's going to get into all this, but to ask for more time and to ask, you know, risks and benefits of procedures, and to ask for, can I be evaluated by another provider to get a second opinion? And providers should really be open to that, because we're not God. And it is absolutely within a person's right to ask questions, do their own research, and hear another opinion. Okay, we're almost at the end here. Number 20 is to know my rights, and that includes this Birth Justice Bill of Rights, the Universal Declaration of Human Rights, reproductive rights frameworks, and to be an advocate. Number 21 is the time to heal and bond, meaning parental leave, right? There's bills all around the country for that too. That parental leave should really be extended, and that people really need the time to heal from giving birth, and that 6 weeks off of work is not sufficient. And most of those 6 weeks around the country are not paid. And so I have many clients that go back to work after 2 weeks. And they're asking me to sign off on their work releases after 2 weeks because they really can't afford to be off work, and there's no viable system right now. We don't have a universal basic income. We don't have paid leave for many medical conditions. We don't have paid postpartum leave. And so that is something that interferes with breastfeeding, number one, interferes with the time to bond with the newborn and the time to heal your body. It takes time. And the last one is to never surrender my inalienable rights to bodily autonomy, and to recognize that my body is always mine, and I don't have to surrender it to a system that was designed to destroy me. So these rights are to be upheld and demanded wherever Black pregnant people are, and should be compensated by federal, state, and local government. Funding sources should be allocated according to the principles of birth justice, human rights, reproductive justice, and self-determination.